mynews.studio.
In Uganda, there was a time when a newborn's first breath almost always came with a risk of HIV. That's changed dramatically. What sparked this global shift?
Today is July 20th, 2025. Let's get into the numbers. A decade ago, more than 500,000 babies were infected with HIV every year. Now, we're down to about 130,000. That's nearly 400,000 fewer babies every year. What actually made this possible?
The biggest factor has been getting antiretroviral treatment, ART, to pregnant women living with HIV. Before these medicines, as much as 45% of babies born to mothers with HIV would be infected, especially in places like sub-Saharan Africa. Without treatment, risks were high during pregnancy, birth, and breastfeeding.
So access to ART really changed everything. But how did it scale up so quickly, especially in countries with fewer resources?
Global programs made the difference, like PEPFAR. That's the U.S. President's Emergency Plan for AIDS Relief, plus support from UNAIDS and the World Health Organization. They paid for HIV testing, treatment, and regular care for mothers. A key move was bringing HIV services into standard maternal and child health care. That way, women didn't have to travel elsewhere just for HIV treatment.
Uganda's progress stands out. They dropped transmission rates from 30% to just 3% in 2 decades. That's not just a number. That's hundreds of thousands of children born HIV negative.
Exactly. And it's not just Uganda. Globally, every year 230,000 more babies are now born protected from HIV. Still, not every country has seen the same success. Nigeria and the Democratic Republic of Congo, for example, still report higher mother-to-child transmission rates.
Is that mostly about healthcare infrastructure, or are there other factors at play?
Infrastructure is crucial, but there's more. There are issues like stigma, poverty, distance from clinics, and not enough trained health workers. Some mothers never get tested. Others start treatment late or stop because of cost or supply shortages.
So how are those gaps being addressed? Is it simply a question of putting more money in?
Funding is important, but now the focus is on integration and new solutions. HIV care is being built into wider health systems, so prenatal checkups, immunizations, and HIV treatment are all linked. There's also an effort to use technology, like digital records and mobile outreach, to help mothers who might otherwise be missed.
Are new prevention strategies part of this push too?
Yes, expanding access to pre-exposure prophylaxis, PrEP, is one example. It can protect women at higher risk before pregnancy or before exposure. Community-based support and education also matter, making it more likely women stay in care during pregnancy and breastfeeding.
There's a bigger lesson here, isn't there? This shows what can happen when international funding, local leadership, and science all work together. But the challenge isn't over.
That's right. Progress has slowed in some regions. Donor fatigue and shifting priorities put future gains at risk. To truly end mother-to-child HIV transmission, we'll need to keep investing and keep adapting our strategies.
So, the real question is, can the world keep this up and finish the job?
That's what we'll be watching. This progress is a model for tackling other global health challenges, but only if the momentum continues.
Today, we looked at the sharp drop in mother-to-child HIV transmission, the critical role of ART and global health efforts, remaining hurdles, and what needs to happen next.
Hundreds of thousands of children are now living HIV-free because of this global push. But there are still millions who need support.
Thanks for listening. This episode was brought to you by mynews.studio. Try it free today.